Hey everybody, happy Friday to you if you're watching this live. Thanks for joining me today. There's a whole bunch of stuff going on with Medicare, and that's why I'm coming to you today. I want to talk to you about the latest thing in the news. As a matter of fact, though, everybody was asking, when are we going to talk about this thing? And it was in the news, and I debated it for a minute. Like, should we talk about it? Should we not talk about it? But the truth is, if anything's happening with Medicare, people come to the channel and they want to know, like, what the behind the scenes things are on this. So I decided to put that together for you, and that's exactly what we're going to go over today. My name is 𝗃𝗲𝗏𝗏𝗏. If you're not familiar with the channel, I go over things having to do with Medicare. I run a Medicare insurance agency located in Charleston, South Carolina, with clients from coast to coast, all the states in between, and we help people using this thing called the telephone. I've been a licensed agent for 26 years now, helping people with Medicare exclusively since 2008. We have thousands of contracted agents across the country and an internal team of 15 where we help people here. Actually, this is our team right here. And so I just want to thank you for joining us today. I want to talk about what's in the news. But first of all, I want to give you a little bit of background for those people not familiar with Medicare or maybe have an upcoming Medicare choice to make. Just a real quick background, talking about the two different options when you come on to Medicare. And they are pretty important. First of all, you could either take original Medicare, which is great. It's freedom. It's opportunity to go anywhere you want to, any doctor, any hospital, anywhere you want to go. You can go. That's original Medicare right there. Then the other option is Medicare Advantage. That's a private program run by private companies who will replace your original Medicare. Now, you all know probably that original Medicare, you have to earn it by working 40 quarters, 10 years of solid work performance all throughout your life. And once you've made it 40 quarters and you turn 65 as of right now, and that's proposed to likely change in the future. Currently, the age is 65. You can start on original Medicare. What a lot of people are doing now is they're choosing to go to Medicare Advantage because they're offering all kinds of things. One of the things we'll look at today is why is it that people are choosing Medicare Advantage in droves? And I've got a solution to that. Original Medicare, again, you can go to any doctor, any hospital that takes Medicare, which is just about everybody. On Medicare Advantage, you give up some of that freedom. You'll have to use a doctor's a network plan, and that means you have to go inside the network for most all Medicare Advantage plans. And they bundle all these things together. So rather than you picking a separate standalone drug plan, you get one that's bundled in there. And it's not one that's particularly perfect for your scenario. It's just one that's bundled in there. So these are the two choices, original Medicare or Medicare Advantage. As a matter of fact, this slide is taken exactly from the Medicare and You Guidebook, and you can find that online. And again, the Medicare and You Guidebook talks about the choices. And this is page 7. Any doctor, any hospital, or doctors and other providers who are in a plan network in a service area for the lowest cost, or no coverage at all if you go outside that. It's important to know the distinction about Medicare Advantage versus original Medicare for this thing here today. Now, this is something interesting, and this is kind of a new development for the Medicare and You Guidebook. This year, they're actually making the statement that we have called on for years. There's not been a distinction in the Medicare and You Guidebook every year telling people that if you give up the opportunity to get a Medigap plan or Medicare supplement plan and keep original Medicare, and you instead opt to go to a Medicare Advantage plan, you may not ever get to go back to original Medicare. There's a recent video, I cited the study that when people have really bad health issues, especially when they're hospitalized for chronic things, they tend to leave Medicare Advantage and go back to original Medicare. Why do they do that? The study states that the study says that the reason why people are doing that overwhelmingly is because they want access to better care, better doctors, better hospitals, freedom to go where they want to, and the like. So now the Medicare and You Guidebook on this year's version, page 60 and page 67 specifically now say, and many of us have called for this, if you already have a Medigap plan and then you join a Medicare Advantage plan, and that's during the one time per year that you can do that, and you drop your Medigap plan, keep in mind, if you drop your Medigap plan, you may not be able to get it back. We see this all the time. Why is that? Because to get on a Medigap plan outside of your open enrollment, that's when you're brand new to Medicare, it requires health questions in most all the states in the union. And then again on page 67, if you drop your Medicare supplement insurance to join a Medicare Advantage plan, you may not get it back. So pretty important that we bring that up. And then on the Medicare supplement side, again, supplementing original Medicare, it's important to know that Medigap policies are all the same, but the only difference is the cost between them. So if you're looking at a Medicare supplement plan G, for instance, or plan N Medigap plan, no matter what the company is, they all cover exactly the same thing. The only difference is cost. Now you compare that to Medicare Advantage, and there's a big difference. See, Medicare Advantage has no standard. And by that, I mean every Medicare Advantage plan is completely unique. Different copays, different doctors, different criteria, different medical directors, different things will be approved. Everything is a complete different mishmash. So it's hard to make a comparison between this Medicare Advantage plan and that one because you can't line them up easily on the same exact criteria. That's important to know. So one is standardized, that's the Medicare supplement, supplementing original Medicare with the freedom to go anywhere you want. And the other one's Medicare Advantage, which you don't know what you're going to get. It's a yearly contract with a private company, and that's what we're going to talk about for the balance of today's presentation is Medicare Advantage and what's latest, what's happening with that. Is it a good deal for taxpayers? Well, you be the judge. I'll just give you the facts. How about that? In the news this week, Humana, it finds itself at the other end of some scrutiny by the Office of Inspector General, saying that they are overcharging Medicare. Now, this is looking back all the way to 2015. That's a long time to let this go undone. This is not unique to Humana. This is not a criticism of Humana, first of all. I am licensed with Humana, and we in my agency offer Medicare supplement plans and Medicare Advantage plans. We do it all. The purpose of this presentation today is just to let you know what's in the news and look back a couple of layers so you can see what the real story is, because you won't find it anywhere else. That's just the truth. So as we look at this report, and I read the whole thing, it says, well, this is a news story. It says this is going to be the largest audit penalty ever imposed on a Medicare Advantage company. And that was the statement by the HHS Assistant Regional Inspector General. This money needs to come back to the federal government, he said in an interview. Hey, you probably won't see him do any interviews after that because that's not going to make him happy in Washington, folks with him. So it's important to show that in this study it says, and this is a story about it, Humana sharply disputes the findings of the audit. A spokesperson for the company said Humana will work with Medicare officials to resolve this review and noted the recommendations do not represent final determinations and Humana will still have the right to appeal. So this is not in any way, shape, or form a done deal, but I want you to know what's in the news. Now, as we look at this HHS report in detail, we start reading some of the text and we look back to prior years and how big is the scope of this problem. And they say, this is HHS, in the fiscal year of 2019, the improper payment rate for Medicare Advantage, that's the MA there, was 7.9%. Improper payments. That's only $16.7 billion, and this was 2 years ago. That's taxpayer money, $16.7 billion in improper payments. But unlike fee-for-service Medicare, that's original Medicare and most often with a Medicare supplement plan, unlike in original Medicare, where CMS pays providers directly for each covered service received, under managed care, CMS makes a capitated payment to a managed care plan for each person enrolled in the plan. We'll look at what that payment is here in a minute. In turn, the plan, Medicare Advantage plan, pays providers for services a beneficiary may require that are included in the plan's contract with CMS. CMS risk adjusts payments to pay Medicare Advantage organizations different amounts for beneficiaries with different expected healthcare costs. So it's not just one flat fee per person. That's the point here. And that's where all the alleged fraud comes from. Notice I said alleged. It comes from these risk-adjusted payments. That's key. The Office of Inspector General has found that improper payments, now every time you see the original news story here and text from the original document, anytime there's a red underline, that's 𝗟𝗏𝗏𝗃𝗏𝗏𝗏𝗏 opinion. Okay, I think that's the most important part, so I'm drawing a distinction about it. So the improper payments in Medicare Advantage are largely driven by improper risk adjustment payments. What are those? It goes on. Now, this is from a story. The top challenges facing HHS. This is really interesting. This is a report. You have to dig way deep in their website to find this, but this is critically important if you're making a distinction as a taxpayer. Is Medicare Advantage a good deal for us, the taxpayer? This says the challenge to HHS is Medicare Advantage programs are vulnerable to fraud, waste, and abuse perpetrated by Medicare Advantage organizations to inappropriately inflate the payments that they would receive from Medicare, or, okay, that's bad enough. You're inflating the payments that you're going to receive from Medicare. That's called fraud. Okay, that's one bad thing. Or, and this is the thing that I talk about nonstop on this channel, or to inappropriately deny care that they are obligated to provide. So you're either denying care, which is another report from the Office of Inspector General, or in this one specific to today's news, inflating the payments that they receive. The Office of Inspector General found that billions of dollars in estimated Medicare Advantage risk-adjusted payments supported solely through chart reviews or diagnosis reported on, here it comes, this is key, reported on health risk assessments. Now, health risk assessments, now it says, are the sole basis upon which these Medicare Advantage plans can get an inflated payment from Medicare. What are health risk assessments? I'll show you how we are bribed, paid, encouraged, solicited by the companies to go out and get these health risk assessments to make those prices go up on what they're reimbursed. I just want to be fully transparent with you, and I'm going to show you the emails that I get behind the scenes as an agent, as an inducement for me to come along with this program and to increase these health risk assessments, okay? Office of Inspector General has made recommendations to CMS to improve its oversight of MA plans so that plans will ensure practices drive better care and not just higher profits, and enact policies and procedures to improve the integrity and usefulness of payment data. And it goes on in the study that says that they recommended this through term of different administrations, and they still are ignored. Here's the part I'll get in trouble with. This is an email I received. Look at that, 2 days ago. Dear broker manager, we have lots of agents underneath us, but remember, you can be reimbursed $50 for your time and effort for every health risk assessment you complete for new members when they enroll in a dual special needs plan. Dual special needs plan is a type of Medicare Advantage for people who are eligible for both Medicare and Medicaid. It's just a type of Medicare Advantage. So set up the expectation with the member up front that the health risk assessment needs to be completed. Let them know it'll take 15 minutes. And again, this is to determine how the health plan can make more money on that same enrolled person. So this is where they're getting the data from. They're telling insurance agents, hey, we'll pay you $50 to go ask this person 15 minutes worth of questions so we can put them in a different high risk category. Here's another one I got. Learn how in this webinar to fill out a health risk assessment and receive an additional $50 on the already impressive commission made on a Medicare Advantage plan. And this is from that webinar. This is just a snippet. So the reimbursement of $50 per HRA will typically be made between 60 days. You'll find reimbursement in your commission statement. We'll itemize it. Yeah. And this is from another company. I'm trying to block out the names of the companies so that no one gets offended. This one is to notify us as independent agents that this month, some of your Medicare Advantage members will receive an automated call asking them to take a health risk assessment. This assessment just takes 10 to 15 minutes, so we should let the people know that they're going to get this automated call and they can talk to a computer and answer these questions so they can get their adjustment from Medicare and get more money from it. Here's one more, and I'll leave this alone. Complete your HRA now. Now you can earn $60 for the enrollment. With this option, it allows me, the broker, to complete the HRA and the over-the-counter order form with the beneficiary. Or with this option, I get $40 by triggering an immediate phone call to the beneficiary from the health plan. Or I can get them scheduled for a call with the health plan and I can still earn $30. Where's all this money coming from? It's coming from increased money to the health plan. And that challenge to HHS goes into more detail here by saying this. Additionally, significant concerns have been raised that the capitated payment model used in Medicare Advantage may provide a potential incentive for Medicare Advantage organizations to, and again, I highlight here, inappropriately deny access to services and payments in an attempt to increase their profits. A Medicare Advantage organization that inappropriately denies authorization for services to beneficiaries may contribute to physical or financial harm, and also misuses Medicare program dollars that CMS already paid for beneficiaries' health care. The Office of Inspector General found that high numbers of overturned denials upon appeal and persistent performance problems identified by CMS audits raise concern that some beneficiaries and providers may not be getting services and payment that Medicare Advantage plans are required to provide. Just going to let that sit right there. That's their concern. The investigative arm of Health and Human Services are their concern that the profit margin on specifically and exclusively Medicare Advantage organizations is so high that by denying care, they improve their profit margin. I covered this exact thing when the original story came out. I encourage you to watch that video and look at that study in depth, because that's a whole facet that we're not getting into today. This is not the news today. This is not new at all. The study that shows that they find that profit is to blame for denied care. If you go to the website called allaboutmedicareadvantage.com, you'll see that study, you'll see that video. I encourage you to watch it. Very enlightening. Allaboutmedicareadvantage.com. It's not biased at all. It's just the facts and showing you what's out there, because I want my clients to know that there are alternatives. You're going to see Joe Namath, you're going to see all these ex-football players on the television blanketing the news all the time. Every time you turn on the TV, it's another Medicare Advantage commercial. Where in the world do they get the money for that? You don't see commercials for original Medicare, do you? No, you just earned it and it's sitting there passively waiting for you to take advantage of it. But you don't see commercials about that. Something might make you go, So let's get into the new. Before we do, will you do me a favor? Will you please hit the like button? It really, really, really helps the YouTube algorithm, just like Fonzie's doing right there. Just the thumbs up thing. I really appreciate it. If you have not yet subscribed to the channel so you can get updates on what's happening with Medicare in real time, hit the subscribe button, and that notification bell will let you know in advance when we're going to go live with new information. And it's always new information. So thanks for doing that. So this is a study I want to show you because this is nothing new. This thing is not singling out Humana. It's not unique to Humana in any way, shape, or form. I'm just going to show you kind of the scope of this and how big it is. This is from 2017. 4 years ago, Medicare failed to recover up to $125 million in overpayments. Well, why would they fail to uncover it? Listen, this is amazing. 6 years ago, I'll make it bigger so you can see it. 6 years ago, federal officials were confident that they could save taxpayers hundreds of millions of dollars annually. How? By auditing private Medicare Advantage insurance plans that allegedly overcharged the government for medical services. An initial round of audits found that Medicare had potentially overpaid 5 of the health plans that they looked at by $128 million alone in 2007 alone, according to confidential government documents released recently in response to a public records request. But, and I highlighted this, officials never recovered most of that money under, here it is, intense pressure from the health insurance industry. The Centers for Medicare and Medicaid Services quietly backed off their repayment demands. They backed off. Now, what gets the government to back off when private industry has such a strong lobby that, caught red-handed, they still are forced to back off? Makes you wonder, doesn't it? They settled the audits in 2012 for just under $3.4 million. And this is small potatoes. This is back when this was just a little bitty thing. It's a lot bigger of a thing right now. I just wanted to show you the history of it. But the chance of them getting this money back is probably slim to none, because the Office of Inspector General, law enforcement type branch, uncovers that there may be potential alleged fraud here, but no one wants to go back and recoup the money for the taxpayer. says right here, shortchanging taxpayers by up to $125 million just for 2007. Yet outside of public view, federal officials have been losing a high-stakes battle to curb widespread billing errors in Medicare Advantage plan. Widespread. According to the records obtained through the Freedom of Information Act lawsuit, the Center for Public Integrity first disclosed in 2014 that billions of tax dollars are wasted annually, partly because some health plans appear to exaggerate how sick their patients are, a practice known as upcoding. Last August, the investigative journalism group reported 35 of 37 health plans they looked at, 35 out of 37 might be a pattern. CMS has audited overcharged Medicare, often by overstating the severity of medical conditions such as diabetes and depression. Interesting. So just want to tell you about this study in this story in NPR. It says, of course, this has a huge impact on taxpayer spending, and very few people are getting involved. Diabetes is one of the most common things that they say this person had diabetes. They really don't. And other ailments, you can get into that in the study. But it's just interesting to see here that with the thing having to do with Humana specifically, this was only looking at 200 cases. 200 sample cases, just like a core sample. They just looked at 200 cases. But in all the cases that they looked at, this is a story from back in 2016. Auditors found in each case, some were over the top and some were under, but here's the likelihood that it's going to be in the favor of the Medicare Advantage plan. Auditors found that there were 3 to 4 times as likely to slash payments, finding that they were overcharged, Medicare was overcharged, than to raise them for many medical conditions. So 3 to 4 times more likely that the error, if it's just an error, is always on the side of the Medicare Advantage plan. And remember, there's little to no enforcement on the back end. The Office of Inspector General can find this all day long, but what are they doing on the back end to recover this money for the taxpayer? Just about absolutely nothing. So this not just Humana, like I said before, this is all the Medicare Advantage companies. The Department of Justice, this is from just last year. I mean, this is really recent, 6 months ago. Department of Justice filed suit against Cigna on Tuesday, alleging the insurer used a primary care program launched in Medicare Advantage to boost its risk scores. The lawsuit alleges that CMS overpaid on claims derived from more than 375,000 visits to this program. Of course, they're disputing it. It's still not settled, and it's just an allegation at this point. But I wanted to look back at the one specific to Humana. This is the one that's in the news. And again, they looked at how many cases? 200. What would they have alleged, or what would they have found, rather, if they looked at 2,000 cases? What if they looked at 2 million cases? Are there more than 2 million people on Medicare Advantage? Absolutely. What if they looked at that? What would they find? They looked at 200 cases. 200. And they found all this. So this particular thing that happened here, they're looking at just one of the Humana plans. They're all over the country, but this one specific contract is for South Florida. This one particular contract has 485,000 enrollees, and they looked at 200. Can you imagine the scope there? They looked at 200 out of 485,000. For the audit period, and again, this news today is from what happened in 2015. This is what the audit period is, just calendar year 2015. And during 2015, just for this plan, just for South Florida, just for these people, CMS paid Humana $5.6 billion to cover these 485,000. If you do the math on that, and I did, you'll see that this is $11,546 per year per Medicare beneficiary. $11,500 of taxpayer money is paid to this private company to take them off of original Medicare for their treatment and take care of their treatment. And they can do it by one of 2 ways. They can make a profit, that is, by one of 2 ways. One, they can upcode them. If they upcode them, they get more money from them. 2, they could decide to restrict care in some way. Prior authorization, which is permission to have something done, referrals required, standards of care, denying care. That's what the other Office of Inspector General report showed. So between these two things, it's called burning the candle at both ends. And increase the money that you're making, and at the same time deny services, and there's the profit potential. So that comes out to $962 per month paid for these people, just right there. So I want to be fair and balanced here and get all the way into this. It says what the OIG found, and this is the summary report. They found, and this is their text, not mine, I'm just reporting what's here. Humana did not submit some diagnosis codes to CMS for use in the risk adjustment program in accordance with federal requirements. First, although most of the diagnosis codes that Humana submitted were supported in medical records, okay, that's on their positive side, most of them were supported, and therefore validated 1,322 of the 1,525 sampled. This is what they're claiming, the health conditions. The remaining 203 were not validated and resulted in overpayments. These 203 unvalidated claims included 20 for which we identified another 22. Secondly, okay, this is the most important part. As a result, from these 200 sampled, they estimated that Humana received at least $197.7 million in net overpayments for the year alone. This is not for the carrier nationwide. And again, this is not about Humana. This is an industry standard. So this $197 million is just for the South Florida component of a national carrier done by a tiny 200-person core sample. Can you imagine the scope of this if this was looked at on a national basis? This is $200 million for a small area of one state in the country. These errors occurred, quote, because Humana's policies and procedures to prevent, detect, and correct non-compliance with CMS's program requirements as mandated by federal regulations were not always effective. That's a highly cautious statement. It's not saying fraud. It's just saying that the policies and procedures to protect against non-compliance with CMS program requirement, that's a mouthful. That's lawyer speak for saying they didn't do it by the program. What OIG recommends in Humana's comments, we, quote, Office of Inspector General, recommend that Humana refund the government $197.7 million of net overpayments and enhance its policies and procedures to prevent, detect, and correct non-compliance. Do you think that's going to happen, that they're going to get that $200 million back for this tiny little sample of people just in South Florida? This is the part you got to listen to here. Humana disagreed with the findings and with both of their recommendations, both to give the money back and to change policy. Humana provided additional medical record documentation, which Humana said substantiated these specific claims. Humana also questioned the OIG audit and statistical sampling methodologies and said that the report reflected misunderstanding of legal and regulatory requirements underlying the MA program, Medicare Advantage. OIG misunderstands the Medicare Advantage program that's run by Health and Human Services. After reviewing Humana's comments and the additional information it provided, OIG revised the number of unvalidated claims for this final report. We followed a reasonable audit methodology, and they go into it in great detail in the report, properly executed our sampling methodology, and correctly applied applicable federal requirements underlining the Medicare Advantage program. We revised the amount in our first recommendation from first $263.1 million to $197.7 million, but made no change to the recommendation of the improvement in policies. So the bottom line is, looking at this, the OIG said, looking at their policies and procedures, when they went back after the first draft report and they gave Humana an opportunity to correct some of these things, their accuracy rate went from a paltry 84% accuracy rate in the sample to now up to 87% accurate. The continued improvement of those policies and procedures based on the results of this audit, as well as the results of Humana's self-audits, will assist Humana in attaining better assurance with regard to accuracy, completeness, and truthfulness of the risk adjustment data that it submits in the future. Medicare Advantage is big, big, big money, folks. This is the number of people that are coming into Medicare Advantage. I highly suspect it's for a variety of reasons, not the least of which is the fact that they spend hundreds of millions of dollars. Wait a minute. How do they get hundreds of millions of dollars? If all the money that they get for Medicare Advantage comes from you, the taxpayer, what portion of that money can be allocated toward advertising on CBS, NBC, Fox News, CNN, every other channel that's out there, radio, print, TV, everything, all the time, nonstop blanket of commercials? That money comes from you and me when we pay our taxes. They're saying there's not enough money to give people Medicare at age 60. There's not enough money to help seniors with long-term care. There's not enough money to do this and do that. Got to raise taxes. Where's the money coming from to run all the ads to get people into Medicare Advantage private plans? And who's looking out for us, the taxpayer, to go back and recoup the money that they have a whole investigative arm that finds out that they've been overcharged? They being we, the taxpayer. New numbers show that this is the breakdown of the entirety of all Medicare Advantage people, dominated by United Healthcare, Humana, CVS, which is now Aetna, Anthem, Centene, Cigna, Molina. So this is the share of the people that are getting your taxpayer money. You got to draw your own conclusion. What do you think? Is it a good use of taxpayer money? Those who've had experience with Medicare Advantage, typically the really healthy people that we talk to, we only have several tens of thousands of interactions with seniors over the last 12 years. We've had lots of interactions, and the people who love it are generally the people who are turning 65 and saying to themselves, I've paid into the system my whole life. Why then do I also have to pay for a Medicare supplement plan? I'm in good health right now because I'm 65 years old. I'm just going to take the free option. I'm going to take the free Medicare Advantage plan. I mean, why not? It's on TV every 5 minutes. It must be good, right? All in one plan, complete plan, everything's included. I don't have to worry about anything until you do. And it's that point when you do that you realize, wait a minute, what's that original Medicare that I qualified for again? Can I go back to it? And as I covered at the very beginning, and now it spells out 3 different times in the Medicare and You guidebook. No, you can't. You can drop your Medicare Advantage plan a couple times per year, or if you move out of the service area anytime, giving you a special election period. You can do it during the annual enrollment period, October 15th through December 7th. And whatever you choose during that timeline goes into effect on January 1. You can also do it during the open enrollment period from January 1 to March 31. You can leave your Medicare Advantage plan. But what happens when you land back on original Medicare? Original Medicare, with all its benefits and freedoms to go anywhere you want to, is good coverage, but it leaves a big gaping hole of what? Unlimited charges on the part that Medicare doesn't cover. That's the 20% on Part B and the hospital admission on Part A, about $1,480. That's the part that having original Medicare leaves a big gaping hole, which is why they call it Medigap. It fills the gap of that hole. And Medicare Supplement, Medigap, with original Medicare is both freedom and protection against financial harm. But again, you can't get that unless you can answer health questions if you try to get into it later in most all states. So if you go the Medicare Advantage route, I wish you the very best. We give everybody that contacts us for a recommendation the entire picture. We show them both paths that you can go. It's right there in the Medicare and You guidebook, page 6. You can either go original Medicare that you've earned, or you can give up that freedom and flexibility for no cost and see what the health plan is going to do for your care. The choice is yours. We're always here to help people with that choice. I'm going to look at a couple of the comments here and see if we can bring some folks' information in there. And I just want to show you our team real quick because I'm really proud of them. Like these people a whole lot. That big tall dude, why I had to make this picture so big, that's me. My name is 𝗟R𝗿𝗃𝗃𝗀𝘁 Westphal. This is my lovely wife, Nicole, which brings all the pizzazz in my entire life. This is Brooke, who helps us out with a whole bunch of stuff on the back end. This is Alexis, who answers our phones a lot. This is Kendall, who helps a lot of people all over the country. This is Robert, who not only does that, but also keeps the office running. The smartest dude with technology I've ever known in my life. When I can't figure out anything, I turn to Robert and he has a solution like in 2 seconds. He knows Part D drug plans and Medicare Advantage like nobody's business. He's an absolute genius. This is Gabby, who started as an administrative person with us, moved into the sales role, and now helps people from coast to coast. And this is Hannah, who's hiding in the background, who keeps the whole office running smoothly. She manages everything for us. And this is Haley, who is out of the office today. She's sick today, but she's usually here helping everybody. She's got the kindest disposition and the most patience of anybody I've ever heard on the phone. And this here in the front this is Courtney. She takes care of all post-processing when the applications are done, getting packets mailed out to people, keeping them sorted, making sure that their policies are getting approved. Behind her is Christina. Christina started also as an admin person and now writes cases across the country. She really takes great care of our existing clients, making sure that they're not paying too much when they get their rate increases. This is Melanie, one of the top producers of Medicare insurance in the United States of America. Melanie has an amazing disposition. She's from Charleston area originally, has lots of family here, and we love her to death. And then this is Brianna. And Bree is, she's also licensed, and she answers our phones, and she helps onboard people and answers questions and follows up with email and correspondence and all that kind of stuff. And this is Nick, a technical wizard that helps us also on the back end, keeping everything straight, keeping all of our recordings straight, and helping us with licensing to stay compliant across the country. That's a very big, challenging job. So that's our team of people that we really could not do this business without. And if you ever need help with your Medicare insurance, please do reach out and let us help. And I'm going to go over and see what kind of comments have been stirring up on the internet land. Let's see. This says, last year, the news media was pushing Medicare Advantage, including segments on Dr. Phil and Dr. Oz programs. I actually got, this is funny, I got a cease and desist order from Dr. Phil's news media organization because I went on, I took his whole program that was about Medicare Advantage and broke it down step by step. It's on the channel here. And we refuted that because, you know, the defense against slander and libel is the truth. Pushed back on that, and they actually told YouTube to knock down my video because it was violating their copyright. But YouTube found in favor for us. The cease and desist went away because everything that I said in there was absolutely truthful, and it was fair use on commenting on the inaccuracies, let's put it that way, of that segment. But yeah, you can look on my channel and you'll see the Dr. Phil segment on there. James says, Advantage is great until you get sick or need surgery. Looks like you've got some experience there with that. Sounds like you got a great team. We sure do. Thank you. Why do Medicare Advantage plan commercials repeatedly use the term entitled? I suspect because they do just like the presidential candidates do, and they do polls with people, live sample polls. And they show them one commercial and they show another one and they see which one pulls the best. And anytime you tell somebody, especially in this day and age, you're entitled to this, you're entitled to that, get what you deserve, get what you deserve, they want to call and say, yeah, I'm a tax-paying citizen. By golly, I've worked 40 years. Give me what I'm entitled to. It's salesmanship. It's copywriting 101. Advantage plans are pushing for physician's assistants to be used instead of doctors. That has to be saving lots of money. Sure does. It's called the horse and the carrot plan or the disadvantage plan. Free isn't always free in the end. Thanks, Chris and the team. Thank you so much. This is a great insurance company. Very nice people who help you make the correct choices. Thank you so much. Yeah, I thought it's like long overdue that we kind of show who our people are. Three men to all women ratio. That's why the guys are smiling. That's pretty funny. Why do supplements go up they go up every year? Because of the medical cost inflation, just the cost of doing business in the world that we're in. Medical cost, unlike technology, generally does not go down. Medical costs go up. On the Advantage side, Congress can continue to throw money at it. On the Medicare supplement side, Congress isn't supplementing that. They really want, they've shown this, they want more people off of original Medicare and onto Medicare Advantage. Well, I thank you all for joining us today. I'm going to go have dinner with my wife, and I promised her I'd be out of here by 5:45. Thank you all so much for watching. And as always, please stay tuned, subscribe, hit that notification bell so I can keep you informed on when and if things change in Medicare. Do you think it will? Yes, things always are changing in Medicare. Thank you all so much. I appreciate you being here. Y'all have a great day.